Good evening. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk to you this evening about slight Class 3 cases that we treat with one removal of one lower anterior tooth. It's a neat way to treat these cases, and I've got 5 of them I would like to show you, and they have different reasons for all of these, and so we'll show you some real short videos on 5 of these slight Class 3 cases that we treat with removal of one lower anterior tooth. So to start off with is a beautiful young lady here. She's got just a little fullness of the lower lip. You can see the lower lip is protruding out here just a little bit more than you would like for it to, and just a real beautiful face. And then we look at it from the front, and there's a slight fullness right in this area right here. So we're going to remove that tooth, and she has an end-to-end bite. I mean, the front teeth close almost on top of the lower teeth. So there's larger lower teeth than there are upper teeth for some reason or another that you'll find these cases. And let's show you what we do with this one. Okay, you can see from the front these teeth are hitting right on there, almost at a crossbite here and here, these areas right here. Let's look at it from the side and see. Now on this side it needs to be a little more to really get to be Class 1. This would have to be brought out here. This point would be in between. See, this one needs to be here. So this lower jaw could move forward slightly and it would be better off. And we look at the other side of the mouth, and it's almost socked in Class 1, about as good as you can get with anything. So maybe your upper laterals are a little bit small in a case like this. Now we can look at them. They are fairly small laterals, and it doesn't put the upper anterior teeth out in front of the lower anterior teeth far enough so that she has a closed bite slightly. Now when you've got an edge to edge bite, you slide forward and you bite, and your molars are hitting too. So you want to open just a little bit to bite something off so that nothing touches except your anterior teeth out here to chew something off with it. And that in a straight end bite, that doesn't work that way. All right, we're going to take this one lower anterior tooth, and we do this sometimes in TMJ work to kind of bring these teeth forward just a little bit and pull the jaw forward slightly, and it gets the condyle off of this retrodiscal tissue just a wee bit, and it quits irritating it. So this is something that we do sometimes in TMJ work, where we're fixing a joint problem back there. Now here is the case in treatment. I'm not going to mess around with showing you all the little things, but you see we've got one tooth right here that's almost in the center of the thing, and here's your cuspids, bicuspids, and everything going back on the side like that. Now we look at it over here, it's a super Class 1, and on the other side is Class 1 too. And so we're going to look, you can look in here, and I don't have these lined up perfectly, but these are 2 bicuspids and a cuspid, and here's 2 bicuspids and a cuspid, and we've got 3 teeth, 3 lower anterior teeth. Even though this is a small look, at the cuspids on the bottom look a little small, put up like that. But now look at the result. Now when we close to now, we've got an overbite and overjet. It's proper, and the teeth can fit together, and when she bites her front teeth together, her posterior teeth won't touch back in here, and that's what's necessary for a good occlusion with that. And you look at that again, that one tooth is almost in the dead center. Again, it's sucked in good class 1, and underneath this fits in here. We drop these teeth back from being right out here on the teeth. We drop them back a little, and this brought her lower lip back. I don't have a good picture of that to show you, but it actually did just let the lip come back in just slightly, where if these teeth were out here, the lower lip looked a little protrusive out here, and it took some away from her beauty, and so it looks a lot better when you get it back there. All right, here the lower anterior with those 3 lower anterior teeth. One of them is normally you like to get a central because the laterals are a little bigger than the central, and so that's we took out a central, the lower left central over there to do this. And that's the end of that. I appreciate you watching it. We're going to show 4 of the cases that we take out the lower anterior tooth to solve the problem, and they have some different reasons for it. Here's a good example of your rectangular arch wire fitted right here, and you make a little jet out here for the thickness of the cuspid right here is necessary. See, and this keeps the incisal edges of these teeth lined up right around here by putting this little cuspid eminence in that wire. That's a perfect example of that. So we'll pitch that in for you. So thanks for watching, and hope you join our group and subscribe to our channel, and we thank you again, and I'll say goodbye. Bye-bye. Now let me stop this.